Dear doctors, we all know most of the chronic diseases starts with weight gain and obesity. In some cases, especially in case of type 1 diabetes and some cancers, the patient might have lost weight and may reach an emaciated state by the time the disease is diagnosed. If we take the history carefully, we can elicit the history of an overweight or obese period before the beginning of the symptoms. Sedentary life and high calorie, nutrient deficient or nutrient excess diet leading to change in the body composition, fat mass lean mass ratio, and omega 3 to 6 ratio at cellular level, toxin exposure of varying nature, and associated derailment in the immune and hormone functions of the body is the root cause of lifestyle diseases. Lifestyle disease usually comes not alone, but as a disease package or syndrome like metabolic syndrome comprising obesity, diabetes, high blood pressure, high cholesterol, high triglyceride, fatty liver, and finally ending up as autoimmune diseases, cancer, organ failures like heart failure, kidney failure, liver failure, etc. Correcting the derailed lifestyle, optimizing body weight and body composition at cell level are the safest and the most effective treatment method for prevention and treatment of lifestyle diseases, including diabetes, heart disease, heart attack, stroke, cancer, autoimmune disease, allergic disorders, emotional disturbances, etc. But in general, the doctors ignore the root cause, lifestyle factors, nutritional derailment, low activity level, and excess fat accumulated in the body, and try to treat each symptom or sign like high blood sugar, blood pressure, cholesterol, triglycerides, fatty liver, aches and pains, etc., with one or more drugs. Anything other than a nutrient including drugs taken as medication or a nutrient in excess quantity is considered a toxin by the body and will increase the workload of the immune system and excretory organs of the body. In many cases, medication itself creates further imbalances in the immune system and hormonal activities and promote weight gain, especially the medication used for the treatment of diabetes, psychiatric disorders, autoimmune diseases, etc., and further aggravates the situation. It is easy to diagnose overweight and obesity. Even though we diagnose overweight or obesity in a patient of ours or a close relative, or in ourselves, or even in our children, we ignore it. When it starts expressing as diseases like hypothyroidism, arthritis, PCOD, diabetes, hypertension, high cholesterol, allergies, aches and pains, we again ignore the root cause and start drugs or symptomatic relief. When our BP increases to 130 or 80, we start an antihypertensive, or when we are diagnosed with elevated cholesterol or triglyceride, we start statins, and we may add a low dose aspirin as a blood thinner to escape from heart attack and stroke. When this progresses to vessel block, we try to overcome with angioplasty or bypass. For arthritis, we continue with painkillers until it is time to replace the joint. For thyroiditis, supplement with thyroxine. For cancer, we depend solely on surgery, chemotherapy, and radiotherapy. The list of drugs we use for ourselves and prescribe to our patients often to take lifelong damages our blood vessels, weakens our immune system, derails our excretory organs like liver and kidney. If we adopt and promote lifestyle correction, we can prevent the occurrence of lifestyle diseases. If diagnosed, this can help in treating it and curing it and prevent its recurrence. In general, when a doctor himself or herself is ignoring his or her health, becoming overweight or obese, it is against the spirit of his or her profession and responsibilities. When reaching the disease stage like diabetes, hypothyroidism, arthritis, hypertension, high cholesterol, etc., we start taking drugs regularly rather than correcting the derailed lifestyle. The excuse is a lack of time for activity and finding healthy food due to the busy work schedule. If the doctor himself is finding solace in drugs rather than the root cause correction, how can he or she motivate the patient for correcting the root cause, which is the lifestyle? Such doctors will do the same for the patients too, prescribe drugs and motivate them to take it regularly and treat complications with more drugs and surgical intervention rather than promoting lifestyle corrections. In our medical education, we give importance on studying the signs and symptoms of diseases and investigations procedures to reach a diagnosis. We learn how to use drugs or surgery. The most important aspect of health, nutrition, physical activity, body composition, lean mass fat mass ratio, etc., has been ignored in the curriculum and in the practice of modern medical doctors, which is the reason for the increased incidence of obesity and associated health issues, which reduces the productivity of the individual, quality of life, and is a social and economic burden on the family and the nation. Now, with the increased understanding on the root cause of many chronic diseases as lifestyle factors and the safety, effectiveness, and economy of lifestyle correction for prevention, treatment, and prevention of recurrence of lifestyle diseases over drugs and surgical interventions, we should incorporate lifestyle correction as a treatment method in our modern medicine curriculum and practice. This can make a revolution in the healthcare sector and is crucial for our nation, large and young population. Cell activation program is a clinically monitored lifestyle correction program developed based on the observation of the Greek physician Hippocrates, the father of modern medicine, who is attributed to the words, if we could give every individual the right amount of nourishment and exercise, not too little and not too much, we would have found the safest way to health. Considering the modern industrialized living, special importance has been given in reducing the toxin entering the body as preservatives, colors, tastemakers, etc. in food, body care, and cosmetic support in care. We doctors should become an example for the public by maintaining optimal lifestyle, maintaining optimal body weight, and optimal health without chronic medication for controlling lifestyle diseases. Then only we can motivate the public and our patients to correct their lifestyle, protect them from diseases, and make our nation and the world at large healthy and prosperous.